So you wake up in the morning and your knee is killing you and you're wondering what the heck happened from the time you went to bed until you woke up. What exactly happened? Let's explore that. Hi, I'm Dr. Shaki from Irvine Spine and Wellness Center, your Irvine Chiropractic and Posture Clinic. Stay tuned. All right, so you wake up in the morning and all of a sudden one of your knees, or maybe both of them, more than likely one, is bugging you. And you're wondering what the heck happened. I just went to bed with no pain and now all of a sudden this thing is hurting. It's usually, if it's we're talking about the pain inside your knees here. So what happens is, one of the things I ask my patients to do is to use a pillow in between their knees if they're sleeping on their side. So let's pretend I have a pillow here, because I'm going to use actually this pillow to use it in between my knees. So I'm just going to pretend, forget about the head part of what I'm doing. I just want to show you this. So the pillow that you're using between your knees are supposed to be between your knees. If you move it down closer to your foot, what ends up happening is your foot is now higher than the knee as you're laying down, just like that. Let's say it's like this. I mean, it doesn't have to be like super thick, even if it's just a little bit over time as you're sleeping. So if my foot is higher than my knee, then what's going to happen is it's higher, so it stretches the ligaments on the inside of my knee, and it causes a lot of pain in the morning. Well, it doesn't have to be excruciating pain, but you're definitely aware of the pain inside your knee. So then what should you do? If you have a tape, like a rock tape or kinesio tape, that would be a perfect one to use, not to necessarily thinking that you're gonna make a brace out of it. But what you wanna do is, because I'm switching over to this side for the sake of this video, so the inside of your knee is hurt, and we already discovered that it's because at night the pillow that was supposed to be between your knees ended up being between your ankles, so it lifted and it stretched the ligament that's on the inside of my knee. So basically, if it's stretched out, what you want to do is you want to bring it closer. So what you do is you tape it. If this is as you can see my foot, you're gonna put the kinesio tape or rock tape over here, and you over the leg, and you diagonally cross your knee over to the lower part of your thigh, and you just bring it from the leg to the knee, and you tape it that way. So I've said this in so many videos, you're not using the tape to support, you're using it as a sensory stimulation to the brain. So the brain pays closer attention to that area, making sure that your movements are more accurate, so to speak. I'm probably throwing you off. Let's make sure that we put a link to the postural neurology concept, so you guys can see it in the description box as well for this video. So we're using the concepts of postural neurology in fixing a knee pain that was created as a result of a pillow that was between your ankles instead of your knees. And here the taping has to happen from the leg to the thigh, not the thigh to the leg. That's all proprioceptive concepts that I'm bringing to your attention. So leg to the thigh, not this big of a tape, just enough to cover the joint, and you cross it over at a 90-degree angle here. Cross it over to the bottom of your thigh, from the leg to the thigh, and make sure you don't use the pillow between your ankles. It should be between your knees. Anyway, I hope that you found this video helpful. Make sure you use any method of communication in the description box to ask me your questions, or just comment at the bottom of this video. And that's about it. Until next time, take care.